So when patients get first diagnosed with prostate cancer, this is a somewhat traumatic experience for them. Many of these patients have never dealt with cancer before or even any serious illness, and it's a little bit overwhelming. There's a tremendous amount of information out there in terms of how patients are managed and treated, and there's several different treating physician types. There's surgeons, there's radiation oncologists, there's medical oncologists, and the information out there as to how to proceed with what type of therapy and what type of circumstance is very confusing. It's for this reason, perhaps more than any other, that we started at Duke about 12 years ago a multidisciplinary clinic where we brought together specialists from surgery and radiation oncology and medical oncology, along with the specialists we have in imaging, in radiology, in pathology, and in our clinical trial and translational sciences, to come up with a mechanism where patients could come in, have a single day of visits, meet with multiple different specialists, where those specialists could converse over the case and come up with recommendations that then the patient could then hear from multiple different perspectives and really get all that information in one context to make the right decision. Our multidisciplinary clinic at Duke I won't say is unique, but is really different than a lot of other clinical settings where the efficiency of being able to do that is just not there. It's hard to put all those specialists together in one environment, and it's hard to schedule patients to come in and spend half a day meeting with our specialists. It's been a tremendous resource for patients to really sift through all the different choices and make the right choice for them in terms of treatment, whether it's at Duke or not. But for us, it's also been an opportunity for us to grow together as a group from different specialties and really form an understanding and perspective from each other. I'm not a surgeon, and yet I've learned so much about surgery through this clinic. It's been very remarkable. There are nuances to radiation therapy I never would have known if I hadn't been talking about specific cases with our radiation oncologist. From these kinds of interactions, we've grown a tumor board that meets now every week to go over cases with advanced disease or other cancers in our field, and it's really brought us together as a community much closer to interacting on a regular basis in terms of our patient care. So for our patients, I think it's been a tremendous opportunity for them to really deal, up front with a difficult situation, to make a very personalized decision through hearing from multiple different specialists. From a Duke clinician perspective, it's been a fantastic opportunity for us to learn from each other and learn how to practice together as a group. And then finally, from a research perspective, it's given us a platform to introduce clinical trials and novel ways of treating patients in this very, very early patient population that otherwise might be overwhelmed by that opportunity. So for us, multidisciplinary care, it's not simply another choice. For us, it is the way we practice at Duke.